Thank you very much, Sir Roger. Clause 12 and 78 prohibit vape and nicotine product vending machines in England, Wales and Northern Ireland. Similar provisions are made elsewhere for Scotland. However, I think it's really important that the committee understands this. Scotland already prohibits vape vending machines specifically. This clause makes it an offence for any person managing or controlling a premises to have a vaping or nicotine product vending machine available for use. This effectively prohibits the sale of vapes and nicotine products from vending machines. And to try and clarify the point for the Shadow Minister, when she asks who is responsible, who is that person, the offence is linked to the person with management control of the premises, as that is the most appropriate mechanism, that they have control over whether the vending machine is present. So that is the answer to her question there. This government will stop the next generation from becoming hooked on nicotine. In order to do this, it is essential that we stop children from accessing harmful age-restricted products. Prior to their prohibition, we know children who smoked regularly use tobacco vending machines as their source for cigarettes. We cannot allow the same thing to happen with vapes. Vending machines do not require any human oversight. It is therefore much easier for determined individuals to bypass age of sale restrictions and, crucially, to undertake proxy purchases on behalf of individuals under the age of 18, as there is a much diminished chance of being challenged. Additionally, by their very presence, vending machines advertise their contents, and this bill will ban vape advertising. We need to ensure that children are protected from harmful and addictive products. Ensuring we remove the ability for children to access age-restricted products is an essential part of this approach. Now, I'd like to turn to Amendment 96 regarding the exempting mental health units from the vending machine prohibition. And I'm grateful to the Honourable Lady for bringing this important discussion before the committee today. Her amendment would allow vape and nicotine product vending machines to be available for use in specialised mental health units in England and Wales. I'm very sympathetic to the needs of adult smokers and vapers in mental health facilities, and I know that this was a topic that did come up during the evidence session. However, we do not currently believe that there is a need to exempt mental health or other healthcare settings from these requirements. Scotland did not exempt mental health units from their vape vending machine ban, and they've had no issues. So I want to be clear, because it's really important that I make this point, Sir Roger. We are not banning the sale of vapes and nicotine products in mental health settings. We are only prohibiting their sale from automatic machines that provide no means to prevent proxy purchasing. Facilities that contain shops will still be able to sell vapes to patients and staff. Additionally, patients in mental health settings may be able to benefit from stop smoking services and the Swap to Stop scheme. The majority of inpatient trusts, both acute and mental health, successfully deliver stop smoking support to smokers. And as part of the Swap to Stop scheme, localities can request free vaping starter kits to provide adults engaging with their local stop smoking services. Awards have now been made to individual services in a range of settings and to specific populations, including NHS and mental health settings. It will still be legal and possible for vending machines to dispense medicinally licensed nicotine replacement therapies, such as gums, patches and inhalers. These important medicines will therefore still be available to patients that are looking to quit smoking or that are struggling with their nicotine addiction.
My right honourable friend give way.
I will give way.
Thank you very much for giving way. And thank you for your chairship, Sir Roger. I thank my right honourable friend for making the arguments around the vending machines, and I thank you for the suggested amendment. I have listened from a public health consultant point of view, and I think there is a reasonable debate to be had here. I am convinced by the arguments that my right honourable friend has given, but I would ask in the proceeds of this debate that this conversation perhaps continues as the bill moves forward and the Department of Health continues to have those conversations. Thank you.
Yes, I'm grateful to her for that, and of course this is a debate that isn't going to stop here at committee stage. I'm almost certain it will be a part of the report stage, and if it is not concluded to the desire of those that wish to see the provisions in this bill, I have no doubt it will be raised in the other place too. But I do think it is really important that we don't end up with unintended consequences here. We've got to get this legislation right. The smoking cessation services available are far-reaching in these settings, and I can see no reason for the exemption, given that, as I say, nicotine replacement therapies such as gums, patches, inhalers, important medicines will therefore still be available to patients with a nicotine addiction in mental health settings, and it is for these reasons that I do ask the Honourable Lady to withdraw her amendment today.